This is Neil Osterweil. I'm speaking with Dr. Soma Shekhar from the Manipal Hospital in Bangalore, India, regarding the use of Watson, the IBM supercomputer platform, in clinical practice. So, Dr. Soma Shekhar, you are really quite advanced, I guess, in the use of this new technology. How is it used in clinical practice in your center?
Thank you. We were one of the early adopters of this particular thing because you know that India is a country of vast population and we have hundreds of cancer patients walking in. And an oncologist is actually challenged with outburst of studies, literature, 14 billion pages, 2,400 articles every time. So the current way we normally use is every case goes back to a tumor board where a group of oncologists sit and come to a conclusion. But you know that in a vast country like India and in oncology field, to able to discuss each and every patient with a group of oncologists would be very taxing. And then we are human beings, that fatigability factor, able to keep update of enormous like 1,100 TB data is very tough. So we adopted Watson for Oncology and it is integrated into our HIS, Hospital Information System, and EMR. So every patient is benefited now by Watson for Oncology. So when we click it, it just reads not only the structured data, all the unstructured data, and in 60 seconds it comes out with the right recommendation to the patient with the right evidence. So it's a very useful companion to us physician oncologists to make sure that we don't make any biases, we don't miss anything, and we are up to date with all the recent evidence, and based on the high quality personalized data we make a decision to that particular patient.
I think it's important for clinicians in practice to understand how this is integrated into your day-to-day care so that it is not you're not accepting the decision, that it is not the decision maker, I guess is what I'm trying to say.
It's not one more extra responsibility to the never-ending things which a physician do. That's the lovely part of Watson which we all loved. It is not that I have to go and enter the data. It is integrated into my EMR of the patient. So when I log in my iPad or the system and I see all the patients, there is one button called as Ask Watson next to the patient. The moment you click it, it goes back and reads all the physician's notes, all the investigations, every medical literature about the patient. In 40 seconds, it makes a summary of all of them. And then in 60 seconds, it gives the output. So it's like it's practically there in your HIS system. And all you need to do is just ask for it, and then it comes out with the details and the evidence and everything. So it's, in fact, when we did a study, we found that it didn't take more than 15 minutes for the physician to actually complete the whole process, which is very, very important in a very busy oncology clinic, which is in India, which everybody runs.
Mm-hmm. And a question that I had about the current study that you were reporting here at San Antonio. What did you find? What were the chief findings of it, about the concordance of of Watson's recommendations with your own clinical recommendations?
As we know that there was no validation study of that large scale ever done. So our main study was to see what is the standard of care. The current standard of care is a tumor board where a group of oncologists in an institution would sit and discuss about that patient with their knowledge and the available evidence and come with the best option, document it, and then implement to the patient. So in our study, we compared the multidisciplinary tumor board group of oncologists at our quaternary center decision versus Watson for Oncology. And we found that there was a 90% concordance between the multidisciplinary group of tumor board physicians and the Watson for Oncology. So we were able to arrive at that high quality evidence-based right treatment recommendation to the patient at such a short interval of 60 seconds.
Thank you, Dr. Soma Shekhar.
Thank you very much. Lovely speaking to you.
Thanks.
Thank you.